Hey there, Skinty here, and we're on for a third episode. And today we're going to do our part 2 Q&A. We did our first part, which was based on just the profession of aesthetic medicine. So if you're interested in that, you can go back and watch that. This one is just now going to focus on our followers. They sent us a couple of questions, and that's what we're going to answer today. Yeah?
Yeah. So I think a few months back we put this question box and we got so many questions.
Yeah.
Actually, I love them. They're very diverse. I think it's like we'll talk about almost half of aesthetics today.
Yeah.
I think they should pay for consultation
Hello.
for this episode.
I agree.
Anyway, without further ado, I think we could just get into it. So, Doc, this question will be for you.
Okay.
Yeah, so the first question was, what's the cure for hyperpigmentation?
Ooh, okay. First, I think what we have to recognize is there are different causes of hyperpigmentation, right? So it could be post-inflammatory hyperpigmentation, which can come from like acne or any other trauma that's happened to your skin, right? Either through lasers or other cosmetic procedures. So that's post-inflammatory hyperpigmentation. And then there's hormonal, like postmenopausal women do get hyperpigmentation changes. Pregnant women do get hyperpigmentation changes known as like melasma, right?
Melasma.
And then, yeah, so I feel like first find out what's the actual cause of your hyperpigmentation. Then we treat the cause and then now start working that way in making it better. So once the whatever is causing the hyperpigmentation is taken away, then you'll already start seeing the improvements of your skin. In regards to cure, I think something like melasma is a very chronic condition and it can be treated, it can go away for a certain amount of time and then come back. So yeah, so no, not necessarily for that. But for post-inflammatory inflammatory hyperpigmentation, if you take away the cause of it, yes, it can go away.
Yeah, I think,
what do you think?
Yeah, what I can add is also it can be genetic. There are people who come from families where your melanin is just always hyperactive. So there's also that. Then also it can stem from some treatment you did or the skincare products that you're using. Yeah, maybe you're using your skincare products wrongly or a treatment then comes back again to post-inflammatory.
Or sun damage.
That's what I want to say. Yeah, sun damage is actually, I think, one of the leading causes of hyperpigmentation, where you have the sunspots and freckles. And sun damage, the hyperpigmentation will now be seen years later. Maybe you're not using
people even
can be immediate, like when you just go out to the sun and you tan and you get sunspots. But what people don't realize is what will be seen in
After,
50.
it's
When
true.
you're around 50 in your 60s, that's when you'll see the sun damage on your skin with the hyperpigmentation. So yeah, in terms of cure, there's no cure. It's managing and treating it, and it can be treated in different ways. We can have now medication, can either be topical medications or oral medications. Then we can go to energy-based devices, so that we're having the lasers, different types of lasers, can use chemical pills. So there's a lot of treatments, hormonal treatments, like spironolactone, there's a lot. Yeah, so as Doc said, the type of hyperpigmentation, what's your cause, that is what will also determine
the end result.
The end result.
basically.
But cure is difficult. Hyperpigmentation is very complex.
Yeah,
Comes,
it can be
goes,
complex.
comes,
Yeah,
goes.
and sometimes it can go.
And sometimes it can go forever. Yeah, but it
once
will
you
need
treat what caused it.
it's one of those actually one of those patients that you stay with them for
A while. You walk with it
you
for
walk
a
with
while.
them for a while. And remember, patience is very important when it
Yeah.
comes to the treatment of hyperpigmentation.
Yeah.
That's something I can say. There's no hyperpigmentation that will go down in a month.
couple of
And I've been
days.
seeing it on social
Yeah.
media. This
I
product will
saw
take
that.
away your hyperpigmentation in an hour,
Yeah.
in 2 days.
Yeah.
That's a lie.
It's a lie.
There's no hyperpigmentation that will go down in less than 3 months,
Yeah.
honestly. Yeah.
Next
So
one.
next question. You were asked, do fillers always move? Do you get that Versace face no matter what kind of filler it is? That's a nice question.
That is a really great question.
Do they always move?
Fillers don't always move. There is a likelihood, it is a side effect, right, that you should be aware of before you do choose to go for fillers. And also it depends where you're placing the filler, right? So certain areas are more prone to migration than other areas, right? And also it depends on the medical personnel who's doing the procedure, right?
Yeah.
Do they know their anatomy? Do they understand working with fillers? Do they know the placement of certain fillers? So all those factors come into play when you're dealing with a side effect, right? For the Versace look, yeah, again, I think it's do your due diligence, find a good doctor or practitioner who knows how to do subtle looks when it comes to fillers, because there are so many people with fillers walking around and you would never know, and that's because they have someone who knows how to do fillers well, injectables really well, right? So no, don't think fillers is always
going to move.
Yeah.
And then also the fillers come in different viscosities. There are those ones that are very light. Those can move
and so
much.
that's why your doctor needs to know these things.
Because
that's an us thing.
Hard fillers, so it depends on the practitioner. So we can say this one is heavy on
the practitioner. So find a good one. And now there's social media, and a lot of practitioners put their work on social media. So find the one that is fitting to your kind of aesthetic, and then that's the person you go to, right?
Yep. The next question.
I'll read it.
You read it. This one.
Okay. So Diana, this one is for you.
Right.
Is there any other method of skin tag removal apart from zapping them with laser? Is there?
I don't think so. Yeah, because this is it's literally like a foreign body. So zapping out is the best. But all I can say is that's not the only treatment for them. So it will be zapped out, but then there's post treatments to prevent it from coming back up. Also how to treat the wound to make it heal well. Yeah, but the initial, or what I would say is I'd advise for the laser treatments for what are they called?
Taking out the skin tags.
Skin tags, yes. Then after that, you can start with you can continue with other medications or treatments to prevent the tag from coming up again or making the wound look bad. Yeah.
I think also the thing is with skin tags, I think everyone has to be aware that there's certain reasons why they come out. Well, sometimes it's genetics.
Familial mostly.
Yeah, mostly. But other times it could be because of insulin resistance, right? It's been, it's been connected with diabetes. Yeah. So I think, also, in obese people, it's due to friction, right? Then it comes up.
So I think skin tags is one of those things where it's not a must it be treated. That's where the aesthetics come in. That's where the aesthetics comes in.
But it does affect people.
It affects where you look, then the treatment can be
if you
done.
feel some type of way about it, then just go get it done.
Yeah, and skin tags is one of those things where your doctor should take a very deep history, because
to find out
skin tags and also a relation to skin cancer, you have to rule it out. So if you have a skin tag, I'd recommend that you first start with a consultation. A dermatologist, a really deep, in-depth consultation. They can refer you to an endocrinologist to look at your hormones and everything. Then after that, once it's been said it's a skin tag, non-cancerous, no issues here,
come to the aesthetics.
Then you can come to us. We now take care of that appearance. But skin tags it's one of those tricky things.
The next one, how to deal with adult acne.
How to deal with adult acne. Again, acne. We can sit here.
We can talk about this the whole year.
For acne, we might sit here the whole day. So I'm just trying to find a way to summarize it. But again, acne, just like hyperpigmentation, has many causes. Why you get acne and why I get acne might not be the same.
Exactly.
So meaning how we'll treat Sharlene's acne and how we'll treat DJ's or Diana's acne might not be the same. Sharlene's might be hormonal. So she needs to be on hormonal treatment. Mine might be a mild, simple, I just need skincare. Another person's might be the severe one. But all we're saying is acne is treated differently depending also on your severity.
Exactly.
Someone who has a mild form of acne won't be treated the same way as someone with severe. So mild acne will prescribe skincare, simple skincare products. You use them as we monitor your outbreaks. But when it comes to severe acne, now that's when we start treatments. So the treatments range from topical treatments, oral treatments, lasers, chemical peels. Again, it's
a whole range. Yeah.
Yes. What would you say about that? I've just tried to.
No, I completely agree with you. It's not one size fits all. Yeah. So it's go see an aesthetic doctor or a dermatologist, and we find out what's causing your acne and just curate a plan for you. And again, with acne, it's patience.
And also your lifestyle and your day-to-day habits also
play a part.
Play a very big role in your acne management. So that's what we'll say about acne. Start with, and make sure you're going to a medical doctor, because acne is not as simple as it looks. Acne is very complicated, and we need to find out why you're breaking out. What's the reason first? I think that's good.
It's closed.
Oh, you love this question, because I think
do tell.
Something you struggle with. So this question is, what's the remedy for genetic hollow under eyes? I feel like they worsen with age, and I've tried many eye creams. I really feel for the eye creams.
I mean, I get it, because I've always had hollowness under my eyes. What would be the best treatment? I don't think there's one in particular, right? Because there are people who've tried fillers and it's worked for them, right? To deal with that hollowness under the eyes. There's some people who've done fat transfer and that's worked for them. So I think those are the options, right?
Others have done lasers, they've worked for them.
For hollowness?
Yeah.
Oh, wow.
Because it will rejuvenate again the collagen.
And build. Okay.
Especially the
makes
ablative
sense.
Lasers.
Others have tried PRP under eye and it's worked for them. So I think it's honestly finding what works for you. Like, again, consultation, all that, to do that. With creams are not gonna.
Let's discuss.
Okay, let's talk about eye creams for a second. I feel like if it's an eye cream that doesn't have a particular active that's targeting a certain issue, it's literally just moisturizer, right? So use your moisturizer.
What ingredients would you like to see in your eye creams?
So if you are struggling now with, like, let's say hyperpigmentation around the eye, you want an eye cream which has like a retinoid or a vitamin C in it, that makes sense, right? With genetic hollowness,
it's genetic.
I mean, I use retinoid under my eyes.
Have you seen a change? Has there been a difference with using retinol? Because when we think about how retinol works,
it's supposed to boost collagen, and that takes a long time. I mean, to be honest, I'm willing to just do a fat transfer.
That's what I wanted to say, because that's where
to do fat transfer for my hollowness.
Where the difference between skincare and aesthetic medical treatments come in. Because with your skincare, you might have to, like the eye creams for the under eyes. You'd have to use it for quite a long time. So, but when you do a fat,
and you might not even see a change.
You might not see a change
with the skincare.
Eye filler, under eye filler, or the fat transfer, you actually see the difference immediately. It's an instant difference. So that's what I'll say about the under eyes. And what I can add,
what she also said about getting worse over age, yes, it will, because we lose volume on the face. So in general, everyone under eye is gonna look more hollow as you age, just because of all the changes that are happening underneath.
I think one last thing I'll just add is, before you rule it as a genetic hollow under eye, even for you, doc, you can go and find out if there's another reason. There are actually vascular issues that can lead to that.
That's true. Though I had this since I was like 3
years old. That's all I'm trying to say.
I was a baby.
Also, for the under eyes, the treatment is not one.
No, it's not one.
Everyone with a hollow under eye needs filler, because your under eye might be hollow because of allergic reactions. You've really been doing this.
You're wearing glasses.
You're wearing glasses. There could be many things that give the shadow to give you the under eye. Then others, But which is the most common?
I think
anatomically,
I think that's
born.
the thing. I think sometimes you have to distinguish true hollowness
from shadow.
From shadowing, and that's what you're trying to say, right? So shadowing could be because of the vessels underneath, or just or the hyperpigmentation that's happening, or it could also be because of eye bags. You know, sometimes when you have eye bags, and it creates like the under eye shadowing.
No one should put a filler under your eye.
No, with eye bags.
Please, if you have eye bags, don't.
It's gonna look so bad.
It's gonna look so very bad.
Yeah. So there's that. So but I guess in her sense, she's very sure, just like I am, which is just it's true hollowness. Fat transfer, filler.
Yeah, for those who you don't know what's going on, no one in your family has the dark under eye. Yeah, go and have a review. There's so many causes that can lead to the under eye.
Okay.
Yeah. Yeah, and the next question, and this one is in your industry.
So
someone asked, do you recommend makeup? And how's the best way to take care of your skin or face?
Of course, I recommend makeup. It's me, right? I love makeup. I think it makes you feel good, look good. Yeah, so if the question is, do I recommend? Yes, I do. If you want to do it, do it. Do it well.
Would you recommend it for people with acne?
Yeah, right? Yeah. I think it also depends, right? If you have inflammation going on and it's pustules and pussy, don't. I mean, you don't want to put anything on that, obviously. But if it's calm, like it's not aggravated as much, go ahead, right?
Yeah.
Because we all want to hide a blemish here or there, or make the breakouts appear less. Yeah, so go ahead and wear makeup. And then these days information is there about like non-comedogenic products. Yeah, so nothing that will clog your pores, obviously.
Because the next question was, how's the best way to take care of your skin or face generally?
Generally, don't sleep with makeup. If you're going to wear makeup, don't sleep with makeup. Take it off before you go to bed. Double cleanse. I actually really advocate.
Makeup,
No, even with sunscreen. Sunscreen.
Really
double cleanse, right? So with an oil and then with a gentle cleanser. Change your beddings. Clean your phone. Especially when you're in the gym. I always have to remember to like wipe down my phone. So I think other practices even outside just that could affect your skin.
Sunscreen, don't forget your sunscreen.
You love sunscreen.
I don't want people to be getting premature aging. So for me that's and because you're saying, how can I take care of my face?
And still on the topic of makeup, wash your brushes weekly.
So then I think what I can add is on the question how's the best way to take care of your face, and find a routine that works for you.
It doesn't
Nowadays,
have to be
the products
complicated.
have become so you're told this is for dry skin, this is for what, this is non-comedogenic. So pick
what
skincare that fits you, then consistency. After that, just keep being consistent with that skincare. You will see results. Then couple it up with good lifestyle practices. Drink your water, sleep enough. Work out,
move your body.
All the good stuff. All right.
I ask you the next one. So this one's for you. What can you do if you want a facelift?
What can you do if you want a facelift?
I know you love this conversation.
I love facelift. Anyway.
Let me answer this one because mine's simple. Because you already know what I'm going to say. Just go to a plastic surgeon. That's it for me.
So Sharlene says go to a plastic surgeon. Anyway, if you want a facelift, that means you want something permanent. You've noticed aging in your skin. Yes, a plastic surgeon will be good. But let's remember, not everyone wants to go under anesthesia. Not everyone wants to go under the knife. So we have aesthetic medicine treatments for the facelift. We can start with threads. They're things like called collagen threads. Collagen threads are inserted right under your skin, and they will pull your skin and give you the lift you want, depending on where you want your lift. Be it your neck, your chin, your upper face, you can do that. Then now the energy-based devices. So we are talking about lasers, so radio frequency, ultrasound. We have many machines, and you actually see
the results.
But know what machine is going to
Exactly,
be used on your
yeah.
face. Is that machine, are you being lied to? People just taking your money, or it's a machine that actually works? Make sure you see photos of patients who've also
Before
done it.
and afters,
Also, some facelifts are done with fillers. Filler being put on the lateral side of the face to lift, but those of course are for your aging is not also very progressed. You're just starting to notice some changes, then I can say you can do the aesthetic. But if you're now advanced in age and you need a very, what's the word? Yeah. Vigorous,
Tight, just
what's her name? Jenna. If you want
Stunning.
a Chris Jenna kind of look,
Stunning.
you get that
I'm doing that.
You're doing that.
What? Did you see her?
What her son?
Oh yeah. No, we already know him. We know him.
Yeah, but now you see the difference. Khloe Kardashian also has that clip.
She did
but
threads.
She's not done surgery. She did collagen threads. So
yeah,
it depends with your budget, what your doctor will suggest,
and how far your aging
process is. Yeah.
I like that.
Yeah.
Okay.
Then there's this question asking, are there any long-term side effects of Botox?
Okay, long term.
Yeah,
I think a lot of, I'll just say from what I've studied, and I'm very open for people to send me what they know as well. There hasn't been a lot of data on the long-term effects of Botox that I have come across. I don't know if you have seen any. I think the only one that I've come across was, I think, the study that was done in 2022, just about how you lessen the action of your muscle. Because what does Botox do, right? It temporarily paralyzes your muscles of facial expression, right? It's your muscles of facial expression that cause the wrinkles to happen, right? Because they move more and so they fold the skin on top. So what we do is paralyze it so you don't move as much. So basically they say after years of doing this, those muscles haven't been used as much, so they can't do what they used to do before. So it will be harder for you to raise your eyebrows because the frontalis muscle. But yeah, so there's that.
Yeah, by that I think it's when you used it for so
long.
Years, yeah. But I think what we're seeing is for Botox, most of the side effects will be
short-term
side effects, which are also
more likely
manageable. Yeah, a bit of pain, discomfort, can have some bumps that will go down after a while. Infection can happen
be treated,
if it wasn't injected in a good sanitary way. Then you can have maybe a bit of movement that's not symmetrical. But good thing with Botox, after 2 weeks, that can be redone and you get a normal
not everything though.
Not everything, but what you're saying, they're short term.
So if you have like what we call atosis, so if so one of the side effects is like you can get like your brow can drop or your lid can drop, and in those cases you have to kind of just wait it out because it is temporary. But that just means for the next 3 months you can have a droop.
So they're mostly short term, but no serious long term. And if at all you get a serious side effect, it will be depending on the depth of the injector they went to somewhere they shouldn't have gone.
It's about anatomy at the end of the day. That and the amount of toxin used.
I'd rather give a low dose.
Start low
then
and
you do
build.
A retouch
Exactly.
Too much.
So if your doctor tells you let's go conservative first, listen. You could always touch it up after 2 weeks to the desired effect.
All right, this is an anti-aging question. So anti-aging drugs that are being used, what available safety protocols should I know as a patient? Then there's another one on anti-aging. What anti-aging products do you recommend? Should one start using them in their 30s? You can start with that one, then the other one.
So they do say we start aging, like start losing collagen and all the good stuff, elasticity when we're 25. So ideally that's the time, or right before the time, that you want to start like anti-aging skincare. The ones I'd recommend are vitamin C, or if some people do react to vitamin C, so it doesn't have to be that, but basically an antioxidant. Have that in your regimen, because it's those free radicals in the environment in our body that also leads us to age. Then Diana's favorite, sunscreen. Very important to have. And retinoids. I love retinoids. Yeah, so those are the key ones I'd say. And a good moisturizer. It doesn't have to be expensive. Moisturizer doesn't have to be expensive. So yeah, just a good moisturizer which has like ceramides and things like that.
So I love sunscreen, but the sun is the #1 cause of premature aging, so we have to protect ourselves early. Then I think the retinoids will work by increasing the
cell turnover, which decreases as we age.
So those are the, in terms of skincare, those are there. And there also other vegan, I've heard of bakuchiol, option
for retinoids.
And retinol is really giving you
safe for pregnancy.
Yeah.
So that's something you can also use, because you're not supposed to use retinoids when you're pregnant. But bakuchiol, you could use that instead.
So in terms of skincare, that is, and not in terms of treatment. What are some anti-aging, not in clinic treatments?
Botox. We love Botox. Fillers. There's the polynucleotides, which is all the collagen synthesis type inducers. So polynucleotides are good. What else would you do?
Microneedling with what has been the solution that's added to your microneedling, but microneedling even alone will stimulate your collagen, so help with anti-aging. Then now we can go now to the supplements. Anti-aging field is huge because there's also the regenerative side. The diet side. But in terms of skincare, I think that was well said. And some of the treatments that are available for you at the moment. So on to the next question. It was, which is the best chemical peel for normal skin, but I've been getting breakouts? She said outbreaks, but I think she meant breakouts.
There are different kind of chemical peels, and obviously curated for different issues and things like that. For normal skin,
so maybe a rejuvenating,
just a nice peel. Superficial one, just for texture, just to help the glow and everything. So I just go for a nice superficial type of peel. There's so many different types. So there's that for breakouts. There's especially go for one which has BHAs in it, so it's salicylic acid that can just kind of get all that gunk out. But
the mandelic acid ones, if you have a really bad acne, they can go deeper.
So I guess it's just there's so many chemical peels, but just go superficial.
Superficial.
Just go superficial. And less, and don't go very high percentage, very low percentage, mild. And you'll be fine.
Just for the glow. There are different types. And when you go to your doctor, they'll choose the one for your need.
For your need.
You have others for hyperpigmentation, for wrinkles, for anti-aging. There are very many different types of chemical peels. But remember, just one thing, most people are scared of chemical peels because they think they will be
it's like the excessive peeling. Not all chemical peels make you have that peeling.
I think we need to repeat that. Not all chemical peels will lead to that peeling.
It's depending on how high the percentage is and how deep they go. So
for the superficial peels, you don't expect
barely.
Those are the ones we do for your glow and your rejuvenation.
Okay, so Diana, and we actually got a couple of these. So it's about collagen. So we'll just go with this one, and then you just kind of umbrella it. Does oral collagen work?
Does oral collagen work? There's oral collagen work. So oral collagen, which is the hydrolyzed collagen, I think they call it. It's one of those things where research is still being done. There's no enough data to typically say they 100% work. But this is what the National Library of Medicine says about oral collagen. Because I know the most issue is some people argue that with the molecule, how the size is, it's absorption. It won't be able to go in. Because you take oral collagen for your skin, your bones, hair. Collagen is literally everywhere. So it says that it was a controlled trial, and they're assessing the effects of oral collagen on skin hydration and elasticity.
Yeah.
About skin hydration and elasticity. So the results said that there was significant improvement in skin hydration compared to those who had not taken the oral collagen. But the supplementation on hydration is based on the source of collagen of that product and the duration of supplementation.
Oh, wow. Okay.
Yeah, so that's why I think brands matter. You need to really research
on the brand.
Because now everyone has jumped on it. There's a lot of collagen and most of them don't work, so you need to know that. Then on matters elasticity, what they found out is that there was no significant difference when it comes to skin elasticity. So that's, let's say, anti-aging. So what they're saying is when it comes to anti-aging, yes, you can use the oral collagen, but supplement with other types of anti-aging treatments. Because when it comes
don't rely just solely on the
but on hydration they saw a significant improvement, though they also say there needs to be still more research done on oral collagen because it's not fully done, so we're still in the experimenting phase of it. But if you've taken it before
and it's worked for you,
continue.
I mean,
what
go
I'd
ahead,
say is research the brand first. And every brand will have a page where maybe they write if there's a research that has been done, what are the results of their product. Make sure you do that because there's a lot of fake collagen going around. I think that's good. That's good. Wow, those were amazing questions.
Really good.
Really like them. So we hope that we've been able to answer for the ones who asked. And I'm sure some didn't ask, but you've been having these questions in your mind. We may not have gone deeply into the details and knowledge because all this is coming up. That's why you need to, if we give you all the tea now, you won't watch more of our videos. So we're giving you the tea in doses. So we hope that we are able to answer your concerns and some of your questions. And so until the next video, bye.